Hello, friends. Welcome to this special episode of our podcast. Today, we're diving into a topic often hidden behind routines of cleaning and perfectly arranged spaces, OCD in the household. Have you ever felt like everything must always be flawless, to the point of wearing yourself out? Are you curious why that urge can feel so powerful? Obsessive-compulsive disorder, or OCD, is commonly understood as an anxiety disorder that triggers recurring thoughts, obsessions, and repeated behaviors, compulsions. In a household context, this might show up as the need to check the door lock multiple times, verify the stove is off over and over, or straighten items until each one is in an exact position. Have you ever counted how many times you check before you finally feel confident? Today, we'll explore how OCD affects daily life at home, from seemingly minor tasks to the dynamics with your partner and children. We'll also discuss strategies to keep your home tidy without feeling pressured every time you see a slightly unfolded paper. Ready to dive in? As a quick note, this material is based on research and expert experiences, but remember, I'm not a psychologist or psychiatrist. If you feel you need professional support or resources, stick around for the closing segment. Now, let's start with the basics. What exactly is OCD in a household context? Obsessive-compulsive disorder, OCD, is often mistaken for mere perfectionism. In reality, OCD is a serious anxiety disorder that triggers obsessions, unwanted, intrusive thoughts, urges, or mental images and compulsions, repetitive behaviors, or rituals performed to reduce the anxiety caused by those obsessions. Within the home, obsessions might center on fear of germs, worry about forgetting to lock a door, or anxiety over items being slightly out of place. Friends, have you ever felt uneasy when a spoon is a bit tilted? And what happens if you straighten it again? Did you know that studies estimate around 1 to 2% of the population experiences OCD symptoms to various degrees? At home, this number could feel higher because attentive cleaning and extra care are often normalized, especially if your partner or family also values tidiness. The real challenge is distinguishing between healthy habits and behaviors that begin to interfere with daily life. Lucky for you, awareness is the first step. So, are you noticing signs that go beyond ordinary neatness? There are some common myths out there. OCD is just about loving cleanliness, or people with OCD are always super neat. In truth, compulsions can be mental rituals, like counting steps in your head or checking behaviors you don't even realize. For example, counting each stair step before going down. Sounds odd, right? But for many, it's very real. So, how is perfectionism different from OCD? Perfectionists often hold themselves to high standards, but can relax if things aren't perfect. People with OCD, however, may experience overwhelming distress if their standards aren't met, triggering unexpected rituals. Think about your own experiences. Can you let go, or do you feel compelled to fix things over and over? One of the most common manifestations of OCD at home is checking, testing door handles, inspecting the stove, or making sure the iron is off. The more you check, the stronger the illusion that things aren't secure. After checking 5 times, you might still feel the urge to check again. How does that feel? Do you find relief, or does your anxiety grow? Checking the door lock, for instance, can consume tens of minutes each morning. Some people even record it in a journal or on their phone. Door checked 7 times, just to feel satisfied. These rituals can drain your time and energy, disrupting your entire routine. I'm curious, if you've kept track, how many checks have you done? Another ritual is arranging, aligning items perfectly. Pillows must line up evenly, the broom must stand upright, and glasses on the shelf cannot shift by a millimeter. When one item is out of place, you might feel unsettled. Have you ever rearranged books on a shelf until the spacing looked just right? Share your experience if you have. There are also mental rituals, like silently repeating phrases, "Everything is safe," "Nothing is forgotten," until the anxiety subsides. These internal rituals are often invisible to others, but for the person experiencing them, they're as intense as any physical compulsion. Isn't it fascinating how our minds can dictate such powerful routines? When checking and rituals become constant, the mental load can skyrocket. Some report struggling to sleep because they can't stop wondering if the door is truly locked. And your partner? They might feel confused, exhausted, or even hurt. Like they're not trusted. Have you ever felt wounded because your partner's checks felt like a vote of no confidence? Household dynamics can get strained. Family time gets cut short by rituals. The atmosphere turns tense, and conflicts begin to flare up. Left unaddressed, OCD can lead to chronic stress, anxiety, and relational distance. It sounds concerning, right? But remember, recognizing the issue is the first step. Does your home atmosphere ever feel like this? Some partners try to help, offering to check, making to-do lists, yet these gestures can be misinterpreted as criticism. We need to learn to understand each other's feelings rather than feel attacked. How do you react when your partner's checking becomes excessive? Many couples find relief through simple agreements. We'll check the door no more than 3 times. This small limit can significantly reduce anxiety. What do you think? Would a pact like this help in your home? If children are in the household, they often mimic checking and arranging behaviors. Kids learn by watching, so OCD rituals can spread unintentionally. For example, a child might start checking the door multiple times because they see a parent doing it. Have you ever noticed a child imitating overly meticulous habits? Extended family, parents, in-laws, siblings can add extra pressure. They might brush it off as you're just being too much or advise, relax, it's not a big deal. But comments like these can intensify guilt and shame for someone with OCD. Have you received remarks like that, and how did they make you feel? Children might develop similar anxieties or rebel against any form of control. In both cases, open communication is crucial. Explain that it's not about being lazy, but a real mental challenge. How would you approach this conversation with your extended family? So, how do you keep a comfortable home without falling into the perfection trap? First, prioritize. Decide which chores are essential and which can wait if you're short on time. For instance, washing dishes promptly may take precedence over organizing every bookshelf. How would you feel if you gave yourself permission to skip one small task? Next, set a time limit for checking rituals, maybe 10 minutes each morning to lock doors and turn off appliances. Then, jot down checks completed in a journal and move on to your day. If the urge to recheck returns, redirect your attention to deep breathing or a motivational phrase. This challenge becomes easier with practice. Sound doable? Sharing household duties with your partner or family members is also key. Create a rotating schedule so chores aren't the responsibility of just one person. That way, the sense of obligation eases and rituals feel less mandatory. How about crafting a weekly chore chart with your partner? Exciting, right? Exposure and response prevention, ERP, is a widely used technique for OCD. It involves gradually exposing yourself to anxiety triggers while resisting the urge to perform rituals. For example, let the door handle sit slightly misaligned and refrain from straightening it. It might be tough at first, but over time, the anxiety lessens. Ready to try this small challenge? Mindfulness exercises can also help. When obsessive thoughts arise, focus on bodily sensations, your breath, heartbeat, or posture. Just observe without judgment. Over time, you'll spot anxiety cues early and calm them down before they escalate. Interested in trying a quick mindfulness practice? Keeping a daily journal of your progress is beneficial. Note which routines you skipped, when anxiety hit, and how you responded. Seeing your achievements in writing can be motivating and give you a sense of accomplishment. Who knew you could feel proud of delaying that one extra stove check? Opening up to your partner and family about OCD is a significant step. Share your feelings, your anxiety, fears, and pressures. Encourage them to ask questions and learn alongside you. Having support from loved ones is foundational for recovery. How would you feel if your closest people truly listened? Support groups, whether online or offline, offer a space to share tips and vent frustrations. Realizing you're not alone and that others face similar struggles can ease feelings of isolation. Have you looked into any OCD support communities? Sometimes, the best friend isn't the one giving instant solutions, but the one who simply listens. Such friends help us feel accepted as we are. Do you have a friend like that? Take a moment today to thank them. If OCD symptoms interfere with daily activities, work, relationships, sleep, or cause severe stress, it's time to consult a professional, a psychologist or psychiatrist. They can offer cognitive behavioral therapy, CBT, and/or appropriate medication. Don't hesitate. Friends, this is a strong step toward a better quality of life. Signs you may need professional help include spending over an hour on rituals daily, feeling unable to leave the house because of disorder fears, or experiencing persistent, obsessive thoughts. Does any of this sound familiar? Have you noted these signs? Finding the right therapist can take time. Try a few until you find a good match. Seek recommendations from friends, family, or mental health organizations. Prioritize comfort and rapport. A therapist you trust will make your recovery journey smoother. Ready to start your search? Thank you for sticking with us through OCD in the household, when everything must be perfect. We hope the insights and strategies we discussed help you understand household OCD better and bring hope for managing it more effectively. Disclaimer: I am not a psychologist or psychiatrist. If you feel you need further support, please consult a qualified mental health professional. Don't hesitate. Small steps today can lead to significant changes tomorrow. See you in the next episode, friends. Stay warm, stay brave, and remember, you're not alone. Have you thought about one small step you can take today for a more comfortable home? Share your thoughts in the comments or our next discussion.